Hi everybody, today's video is about newborns and fever, which is a cause of great concern for any pediatrician. As always, please remember this is general medical advice. For your specific baby, you should call your specific pediatrician. But I just want to educate you a little bit about why we're so concerned when newborns have fever. So, even before your baby is born, you can take some steps to help prevent infections in the newborn period. Make sure both parents have a booster of the Tdap vaccine. That's tetanus, diphtheria, and acellular pertussis. It's that pertussis part, the Tdap, the app part of that helps protect you against pertussis or whooping cough. We don't want you to catch it so that you won't pass it on to the newborn, of course. Most cases of newborn pertussis actually do come from a parent, most often the mother because she's more closely relating to the baby. But we would recommend even the grandparents or any very close primary caregivers to the newborn also have their Tdap booster. Also, if it's anywhere near the flu season, please have the parents and grandparents or primary caregivers receive their influenza vaccine. The infant can't get their first flu shot until they're 6 months old. So in those first 6 months of life, it's true that the baby does receive some protection from antibodies the mom made that cross the placenta, but that's not always enough to protect them. So we would really recommend you get your flu vaccine as well. Now, after the baby's born and you come home from the hospital, a couple of recommendations, please. Do not let the whole world come over to visit the baby because they could have germs. Make everyone who visits the baby wash their hands or use hand sanitizer. Do not take the baby to large public gatherings. Don't have the baby in the church nursery or in daycare under 2 months or around a lot of people, particularly toddlers. You've all seen toddlers with runny noses. Toddlers are little vectors of disease and they touch everything with their hands. They put everything in their mouth so they stay sick. All the viral particles are in those respiratory droplets and secretions. So they wipe their nose, they touch things. It's very easy. And they love to kiss the baby in the face. So a lot of times the source of infection for a newborn is their older sibling, especially if the older sibling attends school or daycare or preschool or something like that. So make sure you train the older siblings to kiss that new baby on the back of the head or on the feet, not so much on the hands because the newborn can put their hands right in their mouth or in the baby's face. That's very important. Now, sometimes this is delicate because you may have a lot of loved ones who want to come visit this newborn or the whole Sunday school class or your whole neighborhood as soon as the baby's born and you get home. Well, first of all, logistically speaking, that's not a great idea. The baby's going to have its days and nights confused. You're going to have to sleep during the daytime, and that's most of the time when people want to come visit, right? So one trick that I highly suggest is to nurse your baby in the living room. And most of the time, this will get rid of any extra company you have that's hanging around. But seriously, the reason we don't want a lot of extra company is if a newborn should catch a germ or infection and then have a fever, it is a true medical emergency. So for a newborn to about 2 to 3 months, we are very nervous if the baby's temperature is greater than 100.4 degrees rectally. Now, let me reassure you, it does not hurt the baby to take a rectal temperature. You just need a cheap, digital quick read rectal thermometer. Now at your baby shower you may have received some much fancier things than that. Digital scans for the forehead or ear scans, or we always laugh at this, the pacifier thermometer. These things are not accurate and we need to make very important medical decisions based on the actual number of the temperature. And so we really recommend a cheap digital quick read thermometer. You only put a little bit of Vaseline on the tip, only the tiny little metal tip goes in the baby's bottom. It is much smaller than the normal amount of poop they can pass. It is not painful or harmful or dangerous or anything else. And because so many important decisions are resting on the actual number, it's important that you do this properly. Now, you do not have to monitor your baby's temperature regularly just in case. You only check a temperature if you think something's wrong with the baby. They may feel very hot, they're not acting right, they're not drinking right, or anything else is going wrong. Certainly check a temp just to make sure it's okay. But I've had parents come in with charts and charts of temperatures they're taking regularly, and that's just not necessary. Babies often are sensitive to environmental temperatures. So you do not have to keep your home 90 degrees just because you have a newborn. In fact, data suggests that keeping it overly warm in the home environment actually increases the risk for crib death or sudden infant death syndrome. So you should only keep your home how you're comfortable, around 68 to 70 degrees, nothing extra. And the baby's temperature, often they run kind of warm natured, so you only have to keep the baby dressed however you're comfortable and maybe one extra layer, but nothing more than that. So what if you did check the baby's rectal temperature and you had a reading that was greater than 100.4 degrees and your baby's under 2 months? That's considered a true emergency. Even if it's after hours, even if it's on the weekends, you need to get direction from your pediatrician's office. Now, we would say in general, if the office is closed, you need to seek further medical care at a pediatric emergency department. But again, this depends on the actual advice from your specific pediatrician. But just know that that is a true medical emergency and the baby needs more evaluation. We would almost certainly do a complete blood count and some blood work, including a blood culture. We would check a catheterization for a urine culture. And in some cases, depending on the scenario and the fever, other symptoms present, the baby may also need a lumbar puncture or a spinal tap, people call it, to look for the cerebrospinal fluid to see if there's any infection in that as well. So blood, urine, and CSF cultures are sometimes done for a high fever in a newborn. This is why it's so important to limit your company, to avoid crowds, to have everyone wash their hands before they hold the baby. And so some parents will ask us, can I use Tylenol for a fever in my newborn? No, not because Tylenol is dangerous, but because if your baby has a true fever, we need to know, and important decisions need to be made, and important things need to be done. For tiny newborns with a true fever, not only would we get those cultures, but we would start IV antibiotics, so the baby would be readmitted to the hospital for very close observation. So I hope this clears up some questions about newborns with fever and how important it is to practice good hand washing and limit the crowds and company and shopping trips and family get-togethers with a newborn. It's just not appropriate until after they're 2 months old and their immune system is stronger and they receive their first round of the routine vaccines at the 2-month well visit. Hope this is helpful.